Okay, as I was giving you an update, there is a lot of problem, which is in fact a lot of anxious people because they are being turned away right now. You know, okay, I just know how to describe this. I just don't know how to describe this to you, ladies and gentlemen. It's very, very desperate situation right now. I have no words how to describe this to you. This gentleman is struggling to breathe. His son is struggling to get somebody to look at him. On the other hand, this gentleman here in this ambulance is asthmatic. He's more than 60 years old, on oxygen supply. His son tells us that he was asked to come here. Aapko bulaya tha, you were asked to come here.
Yes, so we get a call from the DMO office to come here, and the registration was already done. But now we are waiting since for last 2 hours, and nothing is happening here for us.
So no, but they have just announced that they would not be able to take any more patients. So what will you do now?
I don't know that. I mean, they're saying, the cab driver is saying, the ambulance driver is saying that the DMO office cabs will all go to inside. But according to their announcement, yes, the ambulance. Sorry, but according to their announcement, I think nothing will happen now.
Have you tried other hospitals? Your father right now,
I'm searching for since morning from 7 a.m. and I have searched almost 10 hospitals, the biggest hospital, and including the government hospitals, but no bed is available there.
It will look like as if I'm just repeating everything that I've said before. But the only purpose of being here, of trying to show you what is happening, is A, be safe, and B, everybody that you think are in authority, the government, the system, name them. You want to name a particular neta. The fact is that all of them have failed us, and everybody has been left now on their own to fend for themselves. Let's just very quickly take you to Kanpur, where this story, which is very, very heart-wrenching. I mean, it's sad to see at a time when, on one hand, there are people, those who are going out of way to help others. In Kanpur, in fact, this story it shames humanity. A son abandons his COVID-positive mother on the roadside in Kanpur. The woman who lived with her son, Vishal, in Kanpur, Kant, had complained of breathlessness as her condition deteriorated. Vishal took his mother to the Tadbagia area of Kanpur and dumped her outside his sister's house and fled the spot, not willing to take responsibility for his sick mother. The woman's daughter also refused to take her inside the house and left her on the road before local residents came to her rescue. Seeing the woman lying on the roadside, locals in fact admitted her to a local hospital and called the cops. Okay, so amidst the crisis that the entire country is facing, there are doctors, those who have gone above and beyond their duty. I now tell you the story of 5 doctors, women, those who are right now trying very, very hard to try and pick up the call, speak to the patients, help them with medication, help them with their anxiety. These are the COVID warriors on the front line. Take a look.
Meet the All Women's Doctors Helpline. Women doctors in this Vasant Vihar society in South Delhi joining hands to motivate and dispel COVID blues, helping those who are in home isolation.
We decided to activate our colony resource of young doctors and collectively decided that this helpline will reflect the youth doctor fraternity in Vasant Vihar and represent women empowerment. What better way than to have a team of young, competent women doctors who are working around the clock, serving the community and offering their pro bono services to its residents.
The initiative comes free for residents of the society. The doctors who started days ago remain ever ready to respond to queries on phone, Zoom calls and WhatsApp, often helping as many as 800 callers a day. Doing teleconsultations, overseeing CT scan reports of residents and advising them right treatment.
I strongly believe if as a doctor you can give your time to someone, that is the biggest asset. We have to guide them, we have to together make sure that we are fighting the pandemic.
The group is inspired by Prime Minister Narendra Modi's appeal to doctors with COVID experiences to reach out to those who need hand-holding.
An initiative like the Vasant Vihar All-Women Group, this is one of those initiatives which is much appreciated, along with societies who are now trying to contribute to ensure that there is COVID management protocol which is followed. A difficult task because, remember, this is the peak, and clearly with numbers rising, there seems to be more pressure. But the Prime Minister himself had approached the doctors last week and asking them to do hand-holding, especially in those areas which were difficult to reach. Online consultation was one of the part. With camera person Sanjeev, this is Kamaljeet Sandhu in Delhi for India Today.
The problem that Delhi is facing right now is that whatever facilities are being made, they completely run out even before many patients are able to get any help, because it's just a sheer number of the COVID positive patients, like what we are seeing here at this very new Sardar Patel COVID Care Center and Hospital facility. These are very, very testing times, ladies and gentlemen. All of us are trying to help each other in whatever way we can. The best help could be to keep yourself safe, your family safe, so that we don't add to the already overburdened and crumbling infrastructure. Thank you so much for being with us. We'll keep getting you the ground reports from Delhi and all across the country.
Hello everyone, this is Rahul Kamal here. Hope you enjoyed this video. For the latest news and analysis, like and subscribe the India Today YouTube channel, and don't forget to press the bell icon to stay updated.